Now we'll switch gear to the metastatic setting. BRAF mutant, BRAF V600E mutant, mismatch repair proficient metastatic colorectal cancer is a high-risk population where even if you use triplet chemotherapy, the median overall survival is only 19 months. Very few patients can actually receive triplet chemotherapy, but with standard doublet chemotherapy, their median overall survival is only 11 months. So this is a high-risk population. Now, the BREAKWATER study investigated combination of chemotherapy and encorafenib, which is a BRAF-directed agent, as well as cetuximab, which is the EGFR receptor blocker against the standard of care. This is the study design. Again, prospective randomized study design with this three group of patients, one group receiving standard of care, another group receiving the experimental EC plus FOLFOX, and another group receiving EC only. Now, in the last ASCO this year, we have received this information on median overall survival improvement, which is remarkable, from 15.1 months to 30.3 months. So the median overall survival with EC and mFOLFOX in this population actually doubled, which is again remarkable. Importantly, overall response rate was also remarkably superior, 66% versus 38%. And the next is the deficient mismatch repair metastatic colorectal cancer. Now we have another frontline treatment option, which is a combination of ipilimumab and nivolumab. And this was investigated in CheckMate 8HW study. This is another phase 3 randomized study with patients receiving the investigator choice chemotherapy versus ipi-nivo versus nivo alone. And again, the PFS result in the ipi-nivo group is remarkable, 54% in the ipi-nivo group, 54.1 months in the ipi-nivo group versus 18.4 months in the nivolumab group. The separation of this curve is remarkable. The overall survival data is still pending, and based on this data, FDA has approved ipi-nivo combination for metastatic dMMR colorectal cancer patients in the first-line setting. The toxicities are manageable. As you can see, actually the objective response rate is quite high, 71% in the ipi-nivo group versus 58% in nivolumab, and complete responses were 30% in the ipi-nivo group. The toxicities were manageable. Only 14% patients discontinued treatment because of side effects. The next abstract, which was presented and attracted a lot of attention, is the challenge study, in which impact of exercise was investigated in resected stage 2 and 3 colon cancer patients. This was another prospective 2-arm randomized study. In the experimental group, patients underwent a structured exercise program. Also, they were given health education material, and the other group received only health education materials. This was a 3-year-long intervention, and target was to increase physical activity by 10 med hours per week above the baseline. And you can see the disease-free survival curve as well as overall survival curve. The improvement is remarkable. And just to compare with the MOSAIC study, the improvement in 5-year disease-free survival was similar to the MOSAIC study, in which adding oxaliplatin to 5-FU leucovorin improved 5-year DFS in resected stage 3 patients.